Okay, let's get started. Welcome to this session on understanding COVID-19 outcomes by county and end-to-end user journey in the cloud. My name is Casey Lichtendahl, and I'm here with Eric Tassone. We're going to introduce ourselves briefly, and then we're going to talk about why we're here in this session. Eric, do you want to start?
Sure. Yes. Hi, I'm Eric Tassone. I'm a faculty member over at the School of Data Science here at UVA. Recently joined after spending about 12 years at Google as a data scientist. Um, Really excited to be here and enjoying getting integrated into the school. In addition, I also work a bit on a collaboratory for applied data science and business, which functions at the intersection. And this is one of the many ways that I have been a colleague and collaborator with Casey in the past. So thank you all for your attendance and looking forward to having you all have a great session.
Yeah, and I'm Casey. I work at the Darden School of Business here at UVA and teach classes on data science and experimentation, data visualization, analytics, and am co-academic director with Eric for the collaboratory he just mentioned. And a little bit about why you and we are all here is to take this end-to-end user journey in the cloud. So we're going to work on a data science problem. This is going to be very hands-on, this workshop. And we're focused on trying to understand the leading indicators of the summer COVID-19 surge. So let's just jump right in.
Yeah, Casey, one just quick comment, if I could, before we jump in, is again, Zoom, we'd like it to be as participatory as possible. So please, raise the hand, maybe even interject if that doesn't, hamper the flow too much. But we'd really like to encourage it because this session is, although obviously this is a substantively important topic that we're all affected by, this pandemic, the focus of this session is going to be a lot more on the how to do something like this as well. And so hopefully that'll stimulate questions, and you'll want to be asking things about us, and we'll be downloading and demoing some tools. So please, hopefully we can all get comfortable with that level of participation and back and forth.
Great. So let me just give you an overview of the agenda here for this session. So we're going to talk about the problem a bit first, then we're going to talk about some of the tools we're going to use and ask you to download Tableau, connect to BigQuery Sandbox, and then we're going to take some actions. The theme of this conference is learning in action. So some of the actions we're going to take, we're going to build a data pipeline together. We're going to explore and visualize some of that data, and then we're going to build some models, and then we're going to do some explainable AI work with those modeling results. So that's the agenda. We're eventually going to highlight some hypotheses here. In this case, we're going to ask you to read. It's just a few pages. So we're going to ask you to read that here in a moment. And we're going to then talk about, let's see, our data sources. So we've got 4 data sources, and then we'll come back and dig into this pipeline piece. But before we ask you to read the case, and Eric has posted in the chat a link to the slide presentation here. The slide presentation, once you go to that link, you can go to these other links where you can find the video, read the case, download the free trial of Tableau, get to the BigQuery Sandbox, and get to these docs where you can find all of the queries for building out the data pipeline and running the models and the explainable AI piece.
Yep. And just if you are joining and haven't seen the link that I've put about 7 times, please just direct message me and I'll send it to you as well. I'm not going to post it anymore, probably.
Yeah. So we're going to watch the video together. So no need to click on the video yourself. So I'm going to click on that now. We're going to go to that video. Let me pause this here. Actually, I need to go back and stop my screen sharing and share again here. I need to get the sound on for this video. I forgot to do that.
And it'll be about about 3 minutes in duration that we'll listen to. That'll really set the context and before you glance at the case for what we're going to do and why we're going to do it.
First time I'm sharing Zoom, so bear with me here.
If you'd like, I could share the video, Casey.
Yeah, Zoom was crashing.
Okay, let me do the video then.
Yep.
Share with sound, optimize. Here we go. If anybody's not hearing this in a couple seconds, please indicate.
Well, thank you, Dr. Walensky and Dr. Fauci. As both Dr. Walensky and Dr. Fauci just made clear, the Delta variant is a threat to unvaccinated Americans and to communities with low vaccination rates. And the best way for communities to protect themselves from the virus is by getting more people vaccinated. From day one, the president's whole of government response effort has been closely tracking the data on the pandemic and vaccination effort in states and counties. And we've worked with governors and local public health officials to ensure they have the support they need to curb the spread of the virus. Today, given what we are seeing with the spread of Delta in some communities in the country, we're intensifying our efforts to help states prevent, detect, and respond to hotspots among the unvaccinated by mobilizing COVID-19 surge response teams to be at the ready to deploy federal resources and, where needed, federal personnel. These are dedicated teams working with communities at higher risk for or already experiencing outbreaks due to the spread of the Delta variant and their low vaccination rate. Our COVID-19 surge response teams will be ready to, one, surge additional testing into communities to expand detection of the virus and allow public health authorities to do contact tracing to help contain outbreaks. Two, provide therapeutics to help treat those infected with COVID. Three, deploy federal personnel where needed and where requested to address gaps and augment local staff supporting vaccination, testing, and therapeutics work. Four, leverage CDC's technical expertise to help communities experiencing or at risk for becoming hotspots with containment, including assisting with epidemiology, data analysis, field investigations, and other public health response work. And five, as Dr. Fauci and Dr. Walensky have both underscored, the most important step we can take to prevent these outbreaks is for more Americans to get vaccinated. That's why the COVID-19 surge response teams will focus on increasing shots in arms in communities with low vaccination rates or fighting outbreaks, including through targeted paid media into these areas. To be clear, the federal government stands ready to meet the moment and work with our state partners to respond to the Delta variant. And as we continue to work with communities across the country to get more shots in arms, we will also be working with governors and state and local health authorities to identify and address the needs on the ground in places with emerging outbreaks, including potential deployment of federal personnel. Before we open up to questions, I want to close with this thought. Thanks to the President's whole of government response, we are further in our fight against the virus than anyone anticipated. And importantly, in the weeks and months ahead, we will continue mobilizing the whole of government to help state and local leaders bring an end to this pandemic by doubling down to get even more Americans vaccinated and stopping the spread as soon as possible when cases do increase. With that, let's open it up for some questions.
So one quick comment there was the weeks and months ahead. You'll notice that this video is from July 1st. So this is a bit of time travel back, and that's going to set the stage for what Casey talks about next as far as some of the context goes. Should I go back to the slides, Casey? Or
Yeah.
Okay, let me share this out.
Yeah, so maybe put that in the chat again, the link to the slide deck for those that want to follow along with the rest of what we do here.
Sure.
So we're gonna now give you a few moments to read this case. So there's a link here to this case called Mobilizing Surge Response Teams. This case starts with a quote from the gentleman you just heard, Jeffrey Zients. He's the White House Coronavirus Response Coordinator. And this case goes over a little bit about what was going on in Missouri and a little bit what was going on at the national level with this summer surge, and then a preview of the winter to come, which is ahead of us still. And you could read the 3 pages here, and then we'll talk about what we've highlighted in orange as it relates to setting up some hypotheses that we want to test as leading indicators of a surge that we'll eventually collect data on and then build some models using the data. So why don't you, if you've got the slide deck, go on over to this link, Mobilizing Surge Response Teams, and take a few minutes to read the 3 pages here. Okay, so we'll pause and let you go ahead and read.
Casey, just a note, I stopped my share in case you wanted to go back to sharing.
Sure.
Let's take a few more seconds and then we'll reconvene here. Maybe 15 to 30 more seconds.
Okay, let's go through this case a little bit and focus on what we've highlighted in orange. Some experts, we've got some quotes from experts in the case where they're throwing around some hypotheses about what might be some of the causes of a summer surge or leading indicators of a summer surge. And so this first expert, Missouri State epidemiologist, throws out this idea that increasing presence of Delta, this new variant, is potentially a cause. This other infectious disease expert at WashU throws out these ideas that maybe it's more rural, more conservative, less welcoming to vaccine type populations. She goes on to talk about the relaxation of restrictions, this idea that maybe more folks are unmasked or they're ignoring social distancing guidelines. The CDC talks about adults later on in the case that are at high risk of severe COVID. Some of those things include diabetes, folks with diabetes, folks who are obese, folks who are smokers. And then finally, we talk about collecting up some economic data on conditions in each of the counties and some of the economic disparities between counties those data highlight. So these things in orange, some of these things we're going to be able to collect data on. Others we're not going to have direct measures of, but maybe we've got some things that are rough proxies for. So we want to flip over back to the slide deck and talk about these hypotheses and some of the data sources we collected up. So Eric, do you want to jump into?
Sure.
These?
Sure. Yeah. So, obviously there's lots and lots of data that you could bring to bear. And so this is not designed to necessarily be comprehensive, but these were a collection of data sources publicly available that we thought addressed many of the things you saw in orange in the doc, as far as the hypotheses that the infectious disease and public health experts were throwing out. So let's kind of take them one by one, and then we're going to see them in action soon. The first one is there's a project that is hosted on a cloud platform, COVID-19 Open Data. And that importantly has a lot of the outcome data that we'll look at here. It has cases, it has hospitalization, it has deaths, among other outcome variables. And it has them also resolved at different geographies. It has them globally, although our focus here will be the United States. It has them at some cases down to county levels or even smaller, and it has them in aggregate. So that, and in fact, they have a lot of predictor variables in there, but we either went outside or added some other predictor variables as well. I think, Casey, remind me, of the non-outcome variables from the first data source, there's some mobility data. There's measures, there's some cell phone data that, is anonymized, of course, but that measures in aggregate how much people were moving relative to pre-COVID baselines. And so there's some things like that in that data set that are really nice. But we went outside that data set and augmented it with some, first there, CDC Places data, which is a data that CDC makes available, again, at different geographic resolutions, ranging from tracts and subtract level up to county, states, national. This has some of the conditions that are believed to put people at higher risk for COVID mortality, as Casey said. Now, again, these are not individual measures. These are aggregate measures for certain geographic units, but they have things like the prevalence of diabetes in that county or the prevalence of smokers. And they're statistical estimates, but it's something that CDC routinely collects, and we're able to find it publicly. The next was because one of the hypotheses is that political affiliation may be associated with the outcomes, either as probably as a proxy for other behaviors. We grabbed the MIT election data that is county level election data from the 2020 presidential election in the United States. And then the one that was bottom of that sheet had to do with economic conditions and differences in economic conditions. So we grabbed a data set called the MasterCard Inclusive Growth Score data. Some of that is data provided by MasterCard itself. Others of that was MasterCard pulling in things like the American Community Survey, and it has measures like how the proportion of residents in a county who have healthcare access and some things like that. It has a Gini coefficient. So it has some measures that get at inequalities and disparities so that we may have a way to tease out inequalities that may be geographic, they may be regional, they may be economic disparities. And so that's an overview of these data sets. You could imagine more. And in fact, once you have this code, you can actually go and add your own if you're able to join. But these were the things that we thought we could bring to bear on those orange highlighted things in the case reading.
Great. So let's go back up and ask those who want to follow along with us as we move forward to download a free trial of Tableau. This won't take but a few seconds to fill out a form and download that software. We're going to be demoing that here in a minute. And then the other thing you're going to want to do is go to this link here, and I'm going to click on it right now. And then this first big blue button says go to BigQuery. That will get the sandbox started for you so that you have a view like this where we can write SQL queries in BigQuery.
Yeah, and we encourage you all to do this because, again, we said this is a real how-to session. So we're going to build time in for people to be able to do it.
So why don't you take a minute or two here and download the free trial of Tableau and go to this link and just have a browser window open with the view I just showed you here, this BigQuery sandbox view. Oh, we're getting a question. Will this work on Tableau Public? I haven't tried it on Tableau Public. If you can connect to Google BigQuery, connect to a table on Google BigQuery, then Tableau Public should work.
Yeah, and please let us know if it is working for you, the person who made that comment, if you would, there in the chat. If for some reason Tableau Public doesn't do that connection, I think there could be a direct upload of the output of the pipeline later, I think, Casey, right? So there could be a workaround, but hopefully it'll be able to do that connecting.
Well, we don't know which project yet because well, that's a good question. Which project? Yeah. So Eric, how does that work with the sandbox? Do you know?
There should be one. Well, so it's going to depend on whether you're a previous user of this or not. Catherine, if you wouldn't mind if I ask you a question, are you a prior user, or is that the first time you've opened up the BigQuery?
This is the first time I'm opening up BigQuery, and the email I use for most of my Gmail isn't the email I logged in with this, so I don't know if there's a disconnect there.
Usually it gives a name like BigQuery Sandbox and then a bunch of numbers at the end. That should be the one that you use. But for folks that had a pre-existing, you might have if you were a prior user of it, you could have other projects. Is that helpful to your question?
I just see like SQL Workspace. To view this page, select a project.
Maybe it's worth taking a second, Casey, to see the screen because it might be helpful for others.
Yeah, sure.
I think you have to stop the share first. And then, Catherine, would you mind sharing?
Okay, yeah. 1 moment.
Great. And then, Casey, there's a question also as Catherine's pulling up the share from Kent, who says no data on social distancing restrictions. So it's not in this analysis directly, is my answer. Casey, you chime in if I'm not saying it right. We
looked at it, trying to find it at the county level resolution and could not find it.
Right. So it is kind of in that first data set, but it wasn't resolved to the county level. And that's one of the reasons we were willing to put in variables that we think are not directly causal, such as the voting data, that may be proxies for things like that at the county level. It's a very good question that we can also come back to at the very end when we get into the explainable AI piece, which is you have some variables that you believe are truly causal pathway, and you have other variables that you're willing to throw in to get predictive performance, but they may be clues of what data needs to either be collected or what data needs to be collected at a finer resolution. So I would say, great question. Sometimes your hands are tied about the data availability like they are here, but you may be able to still get the predictive power from things that are associated with the variable you don't have.
Catherine, any luck there? I missed the screen sharing. I didn't see it.
Okay. Sorry.
Yeah, this may be helpful for others.
Yeah, so going through the whole steps again. What I did, connect.
Okay. Great.
And then BigQuery.
Yep. Okay, let's see. So yeah, so can you go to the selected project? So one thing don't do is the button up in the upper right, activate. That's like a free trial. The whole point of the sandbox is that you can do it without a free trial.
Yeah, I think we have to select create project.
Yeah, so we're going to do create, exactly. So create project, not to be confused with the activate, because that's a nice option to have down the road if you ever want to try it. Yeah, so you can just give it a generic name like that. You have 12 projects remaining in your quota. That's a sign that you're in the sandbox.
Okay. Awesome.
So you can give it a name if you want, or you can just give it what they gave it. Sometimes it comes up with whimsical project names. I think for our coding that you're going to see later, the project name is immaterial. Is that right, Casey? Great. And then I think you can just give it no org. That's fine.
Yeah, that's fine.
Okay.
Yep.
Awesome.
Thank you for showing it. Let's stay with us for 1 second, though, if you would, please. Yep. Okay, it's creating this thing, and there you go. Okay, it's going to ask you 10,000 things. Let's see, tell it done. Now viewing, great, that looks good. Down at the bottom, you can X that out, and you have the editor up successfully.
Yeah,
awesome.
So Catherine, let's just stay with you because this will be useful for everyone else to see.
And there's one question coming in that we'll get to in a moment. It's about research tools, interviews, define hypotheses. We'll come back to that if that's okay. Edison.
Okay, so could you go back to the slide deck, Catherine?
Yeah, 1 sec. Okay.
Okay, and if you click on the build data pipeline doc, it's the first action there under action, build data pipeline. Yep. And if you just scroll down and grab our first query, so this is Q0, query 0. So starting from the comments down to the semicolon. Yep, right there. That was enough.
Yep, great.
Sorry, trying to figure out how to get the this out of the way. 1 sec, sorry.
And just as she's doing that, I'll just note that first data source. This is what this query is going to hit that public data source. It's publicly hosted. So you've opened up a free thing that doesn't require a credit card, and now we're about to do a query that's hitting publicly available data that's just sitting there. Great. Paste it in. Let's see. Oh, the project name, Casey. That might actually need to change there.
Let's just try to run this. And see.
Yeah, so it's giving you a warning, but let's see, it probably will.
Oh, sorry. Yep, we got to create the data set. We do have to do that. So let's go over to the 3 little buttons next to COVID outcomes data palooza. The name of your project.
Just to the left, a little bit.
A little bit further down, a little bit down, right? Yes, right there, the 3 little dots. And say create data set. And we're going to call this data set COVID.
All caps. Yeah. And everyone should follow along. If you do that, you won't have to change anything in the scripts we give you. That's the one manual thing there.
Yeah. And then just hit create data set.
The blue one. Yep. You got it.
I'm sorry. How did you get to the create data set?
Yeah. Those 3 dots right there. Next, so on the left-hand side, as Catherine's demonstrating, the 3 dots, create data set. If you wouldn't, you can do it again, but we won't actually do it. It by default puts your project name in, and then you give it an ID, which if you make it all caps COVID, it'll correspond to the code we're giving you. And that's basically it. And just then hit the blue button toward the bottom, create data set.
Well, don't redo it, but yeah.
Yeah, but don't redo it. Thank you, Catherine. she's
Okay,
she's
now-
one step ahead of us, Casey.
Now go over to that little triangle that's next to the name or before those hexagons. Yep. And we're going to spin that down. And so you have a data set now. So then now we can run this query.
Yep. And in the parlance of this thing, inside of a data set, now you've just created a table, and your first table is BQ Daily. In fact, you can click on it, if you would, Catherine, and it'll show you the schema, which is nice to see. Next to that is details, just in the kind of the middle there. Yep. Hey, it's 2.4 megs. That's sort of big data, and then it'll actually very handily give you a preview of what the data looks like. Boom. You just hit publicly available huge data set, and you've created that.
Awesome. So let's connect to Tableau now. We're going to connect to this data set, and we're going to build out a visualization. Catherine, we'll just stay with you.
Okay. What would you?
You have Tableau downloaded?
And as you're doing this, I'll say that there are some visualization tools on the platform, but due to the popularity and utility of Tableau and the flexibility you get by knowing how to connect it, we've decided to show you all how to connect this here rather than using the on-platform visualization tools.
Yeah, the Data Studio visualization application that is a part of the GCP platform. It's not where Tableau is. Let's put it that way.
That's charitable. Maybe as this is installing, we could tackle this question, which I don't have a great answer for off the top of my head. Do you use research tools like interviews or for define hypotheses? Edison, could I ask you to elaborate a bit on that? And if you would, we still have Edison with us.
Okay, great. We're opening up Tableau Desktop, and we're going to go through a visualization.
Sorry.
While Catherine's doing that, Edison, do you want to ask your question? Unmute yourself and.
Is Tableau still thinking?
I'm finishing the registering. I just didn't want to give everybody all of my personal information.
You're that's brilliant. Thank you. Yeah, I didn't know if it was a lockup, but you're wonderful. Thank you.
Yeah, it's activating the trial.
Awesome.
Okay, looks good. You want to
right, great.
walk her through
So-
connecting it, Casey?
Yeah, so we're going to a server, and you're going to click on that more underneath to a server.
On the left-hand side, blue
On the
bar.
left-hand side in the blue area, to a server, more.
Yeah.
And there
then
you're
you
going to find Google BigQuery in the list. And you'll just need to so go ahead and sign in.
You say
This'll be-
service account?
This will
No,
be
just,
asking
the first
for your-
one.
Yeah, it'll be
Go
asking
on.
for your Google credential.
Okay.
And it'll actually hopefully just inherit. And this probably doesn't. Yep.
Now
Hopefully
go
is
allow.
that the account that you used for the BigQuery though?
Yes.
Okay, perfect.
Yeah, that's the one I use for most Google stuff.
Perfect.
Okay,
Perfect.
now you're good. You can close this tab and
then-
go back to Tableau.
And now we've connected these two.
Yeah, now
Wonderful.
select the billing project.
That's, you don't have to
Yeah,
do that.
okay.
Yeah, but fine. Okay,
That's your
great.
project, which after you created the project, it should be there. Yeah, COVID outcomes, data pools are great. And then your data set, you only have one data set, COVID.
Yep. And then there's the table.
Have your table, you're going to pull your table in. Just drag it onto the canvas there where it says drag tables here.
Yeah, there you go.
Drag it over. Yep. Okay, great. So now let's go over to sheet 1.
And as you're doing that, I'll just notice that if you do updates over in BigQuery land, you can just say update. So once these are synced in a session, they're synced. They sometimes manually update, but you can force it if you went back and say modified your query, which we'll actually do later.
Okay, so go over to sheet 1. We're going to build out the visualization that looks at deaths over time. So what we're going to do is we're going to pull date into the columns shelf. So underneath tables, the word tables on the left, you've got all of your fields in your table. So you've got date, state on top, and then you've got the other quantitative or continuous variables below the line there. And we'll be pulling those things into the columns and rows shelves to create these visualizations. So let's pull date into the columns, which is essentially the x-axis. And then we're going to pull daily deaths into the rows, which is essentially the y-axis. Okay, so now this is automatically selected to summarize over the year. So we're going to go up to the blue pill there, which is the date pill, and we're going to change that to exact date.
Sorry, how do
Pop
I,
that down. Michael?
I'm sorry, how do I create, I've created the Tableau thing, but I don't know how to upload the BQ state daily to it. I've been swapping between Chrome and Zoom, and I sort of missed the.
Oh, yeah. Let's see. If you go back there, yeah. Does this answer your question, Michael? What Catherine's demonstrating? Or
I can't get BQ state daily from one tab to the other because my
just
Tableau is in the browser. It's not a window. It's in the browser.
Oh,
Are you using Tableau Public?
Yeah, I'm using the free trial.
The free trial should download the software to your local machine.
No, I was given a link for a site.
I have the same experience as Michael, actually.
Yeah, same here.
So
Ditto.
did you get to this part where it was
Yes.
days left in free trial? If you go to the middle right here, there's download Tableau
yeah.
Desktop.
Yep. Thank you.
Yeah. No, I
Yeah,
did
so
that earlier.
I
Thank
don't
you.
know how to do this from Tableau Public. We haven't investigated that. So as Catherine just showed, download Tableau Desktop so that you've got a local piece of software on your machine and you can open up
Yeah,
a separate
and
window.
then download current version will take you to Windows or Mac. You'll have to register again for the free trial once it's
And
downloaded.
how would I get the data from the Google Cloud's BigQuery sandbox onto my local machine?
So
We're just connecting to GCP BigQuery from Tableau. So when you open up Tableau, a new Tableau workbook, you'll see some options to connect to a server, and you'll go to more there in that list. And one of the server options is Google BigQuery. It'll ask you then to authenticate, give Tableau access to BigQuery, and you go from there.
Yep.
Then you should see the data set that you created called COVID, all caps, and then the table underneath it if you run that first query, Q0, in a BigQuery editor window. Wendy, are you with us on the need for Tableau Desktop? The answer is yes, you do need the desktop. Michael, is that?
Yeah,
Is it working for you now, Michael?
I'm still downloading it. So.
Okay.
Okay, we'll check back with you in here in a bit. So let's go over to sheet 1 again, Catherine, and we'll see if we can improve this visualization. So this is just daily deaths over the 2 years in the data set. So it's aggregating up over all the days in each of those years. So we want to get to finer granularity on the time scale. So we're going to go to exact date. It's pretty far down in that list, exact date. Good. And then we're going to drag another daily deaths onto this rows shelf. So we're going to put the moving average over this. You can see there's a lot of seasonality. There's a big day a week effect. So we'll just average over that. Yep, so just add that one there. So it creates a second one, and now we're going to create the moving average. So if you right click on that, we're going to go down and make a quick table calculation. One of the options is the moving average. Moving average. And so that's on the bottom, the moving average. And if you would then just right click anywhere on that moving average and go, actually, maybe we're on the, can you click on that show me thing so we can get rid of the up in the upper right. That show me tab. Just click on show me so it hides that. Yeah, good. Okay, I think if we right click on the y-axis label. Yeah, there. Just right click somewhere there. And we can go to dual axis. So we'll overlay those. And then if you right click on the right axis now, the right y-axis, that's the left one, yeah. You can synchronize these axes. Good. And now I think if we click on in the marks card, we click on the second layer. Yep, that's the second layer, good. And we go to change that to a bar chart. It's automatic right now. Yeah, drop that down, change that to a bar chart. And then we can change the size of those bars. Just click on size and move that all the way to the left. Good. And this is a view of now daily deaths aggregated at the national level. Aggregated to the national level, and we've also got the moving average on here. So we need to change the moving average. Actually, this isn't the quite the 7-day moving average. This is like the 3-day moving average, which is weird. So
yeah,
if we go up to the second pill in the row shelf, we can change the way the moving average works. So we can edit the table calculation.
And this has been very common, right? You've probably seen a lot of public depictions where to wash out the weekly effect, you have it be a multiple of 7. So either 7 itself or 14 is sometimes used.
Drop down on that. So we're going to do the previous 6, which includes then the current value, which gives us 7. So that's the 7-day moving average. So just click the X. Yep, that's good. And X
Great.
out of that. Upper right. Yep. And this is the visualization that looks very much like what you'll see on the New York Times webpage when they show what's going on at the national level in the United States with daily deaths, and when they overlay like a 7-day moving average.
And then one quick thing, Catherine, if you could take the mouse and put it at the July 1st date on the x-axis, if you would. I just want to for 2021. That's 2020. And so, yeah, approximately in there, July 1st. The video you saw at the beginning, remember, we're at July 1st. And so We don't know that this peak is coming, this Delta-induced surge. We're starting to see signs of it. Public health experts are. So just to set expectations of what we're going to do next, that's our vantage point, July 1st. And rather than actually try to forecast that exact shape, we're going to look at the deaths and other outcomes over the whole period. So thank you. This visualization captures nicely where we are and what we're hoping to do from a predictive viewpoint.
Yeah. Catherine, if we could stay with you, we'll do the next visualization. We need to run another query, though, to do it. And we'll open up a second Tableau notebook to visualize some data at the county level. So this is data at the state level that we aggregated up to the national level by doing the sum over all of the states that are in this table. We're now going to run our second query, which is called Q1. We're going to go back to BigQuery.
So is that right here or a new workshop? Or?
Back in your browser.
Back in your browser, you'll go to the tab where BigQuery is open.
Yep.
And so we'll go to the unsaved there. See that unsaved? And we'll want to go ahead and save this. So yeah, go to save and say save query, and you'll erase that what's there, and give it a name that you're going to want to that you'll remember, and you can easily go back.
Yeah, and notice, by the way, it does have the ability to save this as either a personal query or, since data science is a team sport, this actually supports teams and projects. So if you were working on somebody with this, you could save it, they would immediately have access to the query and vice versa.
Okay. So now we've got a saved query, and we'll just go over to our doc where query 1 is and just copy the second query and put it beneath this query. So we're just going to do it all in the same editor window. We're just going to stack the rest of these things. All the way down to the semicolon. Yeah.
Perfect.
If I may interrupt, could you please, because the Tableau just, I was able to open it up only now, and I've connected it and I've got the data loaded. How do I get to the graphing part for the visualization?
RN, do you want to follow along with what we're about to do here with this second query? We're going to visualize the results of the second query. Okay, so do you have query 0 and Q0 and Q1, the two queries, into the editor window?
Yep, there's one. And now you can either run them all again, or you can just select query 1, if you would, Catherine, and then push run, and it'll only run that query. Great. So again, we're hitting the public data set, and you're building your second table.
And Catherine, real quick, if you just go down to the bottom of Q1, query 1, there's a where clause there, and we've set the aggregation level to 2. And the key for the open data that BigQuery puts out is that aggregation level 1 is at the state level, and aggregation level 2 is at the county level. So what we're pulling now is all these fields for each of the counties over the entire time frame they've saved data for COVID outcomes.
And quick sanity check, Catherine, if you would click on the new table that's been created just to the left, BQ County data, you can do those same 3. There's the schema. Let's see the details. Next. Not a lot to learn from this. Okay, looks
number
good.
Of rows.
Yep, number of rows is critical.
3,000 plus counties in America, but this is back all the way to January of 2020.
Right.
On a daily basis.
So 2 million rows, by the way, which is, far in excess of spreadsheet land, right? And it just cranked it. 2 million rows. Still small data in some ways.
RN, did that query 1 run for you, Q1? You now see.
Oh, I'm trying to figure out how to save the previous one to. I'm not back on that window where I can paste the second query. I'm trying to locate that.
Are you in Tableau or?
No, I'm on the BigQuery thing. Edit schema, view row access policies. because I did run the first query. So I'm trying to see how to get back to that screen to paste the second query.
So do you have an editor? Do you have a browser window open with
Yes.
this Google Cloud Platform? And then inside that browser window, is there this editor tab? It may be called unsaved if you didn't save it.
Yeah, it's called unsaved.
Yeah, go in that window, go into that editor window and paste the Q1 query down below your Q0 query.
Okay.
So Desmond, you're asking about a link to the public data. There is a link to the public data, but you don't need it to be running these queries.
Exactly. Casey, if I can interject, I just posted that there. This is a great question. Sorry to interrupt you. That's the repository where it's sort of kept and described. But part of the beauty of this, if we look at Catherine's query, the line 44 right there, that is all that's required to hit this data set. So if you're used to thinking of the idiom of a CSV being on your desktop or a database being somewhere, it's in the cloud. And that is the unique link that goes to it. That BigQuery -public -data dot COVID-19 open data, that's the data set. That COVID-19 open data, that's the table. So it's living in the cloud and it's accessible to you in the cloud. Desmond, is that responsive to your question?
Great. Okay. So now we're ready to go back to Tableau, Catherine, and we're going to build out a visualization of two of our states with this county data, and it's going to be very revealing. So we're going to do Missouri because that's what prompted this summer surge. That was the first state that reached out to the federal government to get some support from these surge teams. And we're also going to look at Florida because in our early investigations of this problem, we noticed some weird things going on with some counties in Florida. So we're going to take a look at that visually in Tableau. So
and I'm a Floridian, so I can speak ill of Florida just in case anybody wants to. I'm allowed to. I grew up there.
So we're going to open up a new Tableau workbook because we're going to connect to a different data source. A new, just a new workbook. So just go down to your icon at the bottom.
Is it worksheet, Casey? Is that the term? Yep.
No, not worksheet. You're going to open up a whole new Tableau workbook. So go to the bottom where your icon is, the very bottom, the down where types are, yeah, right there. Right click on that.
Oh.
And open it up again. Open up another Tableau. No, this is the other. Okay, say new. Yeah, new will work too, a new file. Great, we're continuing the trial. Got a new workbook, and we need to, so now go over to data source at the bottom. Okay, we're going to connect to a server.
Notice how
Google BigQuery is now on the list. Okay, good.
Yeah, it added it to the list. That's kind of a nice thing. If you're doing it for the first time, you won't see it there, and you'll do the more that Catherine demonstrated. But once you've used it once, it knows that you're friends with it, and so it puts it there.
Yep. So we'll click on that, sign in again, and now we'll connect to the county level data. Allow that. Now we're good. Very good.
There we go.
Okay, perfect. Now we'll go over to sheet one, and we're going to build out visualizations of now cumulative deaths. And we're going to do cumulative deaths per 100,000. So we're going to put the date in first up in the column shelf. So this is the x-axis again. So we're going to look at a time series of cumulative deaths. And we're going to do exact date again on that one. Okay, and pull in cumulative deaths and pull in state into the filter. Oh, we're good there. Just leave that there. Just pull state into the filters. Yep, it's right above marks. Yep. And we're going to click on Florida. There's Florida at the bottom there. And then scroll down to Missouri. We're going to click on Missouri. And then apply. Okay, and then pull state again into color. Into the
Pull
marks.
state into where?
Color on the marks card.
Ah.
You need to pull the pill. Yep. Yep, right there.
Ooh, looks like it just, oh, there we go.
There we go. Okay, so now this is cumulative depths for these two states. Florida's in blue, Missouri's in orange. But these are not normalized for the population.
Right. This is
Florida's
not a
got
meaningful
way more
comparison
people.
yet. Yep. To make this right, exactly. So this is a correct visualization, but potentially misleading because Florida has more people, right? Among other things. So
Yeah, so we're going to remove from the row shelf, we're going to remove that cumulative depths, and we're going to create a new field. So just pull that off the shelf. Yep. And just right click in the white space below those measures over on the left side in the table
Here?
section. Yeah, right there. Just right click anywhere in the white space and create calculated field. So we're going to create a new field. This is a derived field from the existing fields in the data source. So we're going to call this cumulative depths per 100,000.
I'm sorry, how did you get to a bar chart, bar plot? I'm only getting, I'm not getting that output when I have Missouri and date and state loaded in.
Bar plot. We had a line chart, I think. Before. You want to put cumulative depths back on the row shelf, Catherine?
did yours not default that way, Michael? Is that?
No, it did not.
What did it default to?
I don't even know how to read this plot. It's just a bunch of boxes of equal size divided between 2020 and 2021.
So go into date and go down to exact
date. Yep.
You may have year wrapped around date, which is aggregating things up to the yearly granularity. We want to just work at the daily level, which is the lowest level of granularity we have.
All right.
Does that help? Yeah, okay, so let's create this field. So we're going to pull that thing off and create this field. So right click in the white space, create calculated field at the top. And that's cumulative depths per 100,000. Catherine's spell checking on the fly.
It's awesome.
Okay, we're going to make that, whoa. It doesn't, yeah, let's edit that. We didn't define anything. Okay, so we're going to do sum of, yeah, good, sum. Click on that function and then put inside there, just start typing cumulative depths. And then we're going to divide by sum, which is, yep, there you go. And then sum again. And then we're going to sum up the population. So we'll start typing population. Yep, it'll auto-populate for you. And then we're going to multiply that by 100,000.
In the
That's
front?
going to be a per capita number, and there's 100,000 people in each 100,000 person chunk. Okay, good. We're going to click OK. And now we're going to drag that new field we just created, that derived field, and put that on the row shelf. And this should update our chart so that.
Sorry, that's cumulative depths divided by what?
We divided it, so sum of the cumulative deaths divided by the sum of the population, and then you can either in front put 100,000 or bracket it around with parentheses and multiply it by 100,000, just so it's not some really decimal number. It just puts it on a sort of easier to see scale. Yep, exactly that. Thank you. Note the parentheses that she wrapped the division, and so that the 100,000 doesn't do something weird and be in the denominator.
You don't need that in respect to order of operations.
Okay, great. So notice a couple things here. Again, the July 1st vantage point, if you would hover there on the x-axis for a second, that's where we are in time, kind of, right? And then, again, being the Floridian, I can speak to it. What's going on with the Florida line there? Catherine, any theories? What's the data literally saying is happening in Florida during that period?
Theoretically, a whole bunch of people died on the 13th of September. Realistically, people got recategorized.
Yeah, or what happened between late June and July 13th? Same idea. How many died then?
Oh, nobody, basically.
Okay, so this is not credible data, right? And it required some digging to figure out what went on, but there started being reporting, basically a blackout on the reporting. So this is the kind of thing that the EDA can help you to see and help you to say, like, well, it could influence the study period, for instance, but it certainly allows you to visualize and assess the credibility of the data. Does everybody see that? That horizontal period is saying that the cumulative deaths did not go up. That would be a wonderful outcome if it were true, but we know it's not true, in part because of Catherine's first observation was that a lot of people died on one day. But what really happened is that blue curve, you could probably estimate what that blue curve did with your mouse there. What would you guess it did? Kind of was going up and connecting to that other line it's not doing that for sure. Okay.
So I'm dropping into the chat a news article from the Tampa Bay Times about what was going on in Florida during this period.
It came to me, Casey. I'll repaste it to everybody. Y'all can read more about this later, since we have obviously only a finite amount of time here. Whoops, did I just put the wrong GitHub thing in? I didn't even get it right, Casey. I'm sorry. I'll put your link back in. It didn't copy correctly. Hold on, I'll get it here.
Folks would like to read about the missingness in Florida, you can read about it in the article.
Okay, there it is.
Yeah, there it is. Okay, so a little bit of EDA here with a few initial queries to get a sense for what's going on in the data and some of the missingness we have here and how we're going to define the summer surge as a result of this. We want to include the Florida counties. It's 67 counties. It's useful information for building out better inferences here in terms of leading indicators of the summer surge. So we're just going to go ahead and define the summer surge as a window of time that captures this missingness. So we're going to go from, I think, June 1st through September 14th. The reason June 1st is that's a Tuesday, and September 14th is also a Tuesday. So it's going to be 15 full weeks. Just to stay aligned on the calendar, the days of weeks. We have the same numbers of each of the days of weeks. Okay, so that's going to be our summer surge, and we're going to click back over to BigQuery and copy in the rest of the queries, Q2 through Q15.
Yeah,
Catherine, maybe we can have you do that.
Which without the upload though, Casey, the uploading process, which we may have we may just have to
copy it, and then we'll go through some uploading here.
Yeah, I just want to keep an eye on our time so we get to the explainable AI. That might be something we demonstrate on our machine and leave as an exercise to folks to do those uploads.
Yeah, we can do that. Why don't I flip over to my machine and we'll
Yep.
demonstrate some of
stop the share real
data
quick.
uploading that way.
Yeah, and so as we're switching over, I'll just say, so there's a bit of this will take you some time offline, but we have in the doc that you opened up from the slides, it describes a process where you can go get these 4 different CSVs that we've posted. They're from those other data sources, CDC, the election data, those type of data sets. We've cleaned those a little bit for you, but you can get those there. You can upload them, get them into BigQuery. So to go back actually to Desmond's question, those first couple queries were hitting a publicly available thing that was already in Bigtable. What those other steps that I think we're not going to have, yes, real MVP, Catherine, thank you. Great comment by Clay. What those steps that you're not going to see here, just in the interest of time, would be you putting your own data sets into your own BigQuery repository, I guess, and then being able to do the same type of querying, but kind of locally. So it's sort of, Desmond, this in the next stage that we're not going to see, you're going to physically get those CSVs, upload them, do some stuff with the schema, and then be able to run the queries that Casey's going to run. We've already done those uploading steps of the 4 CSVs. All right, screen sharing, but still dark there. Casey, are you sharing? And you're muted too. Okay.
Yeah, my Zoom is crashing here.
Do you want me to share? Yeah. Okay, and I'll let you talk through it. So let's see. Great. What are y'all seeing for are y'all seeing my screen yet? Hold on, might have picked the wrong screen. Screen share? Yeah, we don't want that desktop. We want this. Share. Okay. Casey, are y'all seeing the right thing?
Yes.
The slide deck. Okay. So let me just say a little bit. These are the steps in the doc that you all can do afterwards. You'll get these 4 CSVs downloaded to your physical machine, and then you can actually upload them through BigQuery storage, make them available. There's a little bit of trickiness here where you'll paste in a schema. This is a little bit of the data wrangling that we did on your behalf. You'll upload those. And probably the key thing here is this 3rd step. You tell it the number of rows to skip as people have. We do that in Python. We do that in R. You'll do it here. For all of them, it's 1, except for the MasterCard data, you'll skip 3. We're going to take that offline and you'll have the instructions to do it. And we're going to pretend that process is already done. And now we're going to get to the queries themselves, which I guess I'm going to take all 15 of these queries, right, Casey? Mm-hmm. Yeah. Okay. Once that data preparation, which has been somewhat done for you, is complete, and you have these things where they can be accessed by these queries, you'll go back to the query editor, which is what which I don't have open yet. Here it is. Let's get the BigQuery. And I will here paste in those 15 queries. And I guess I'm going to go ahead and run them for everybody. Or do we want to go to the schema?
Yeah, let's Eric, you already have that query saved to our project. But yeah, we'll talk a little bit through the 15 queries that assemble the final data set that is going to be used for training and testing our models. And we'll just talk a little bit about this workflow here. So you've got the Q1 query we were just running at the county level from BigQuery's open data source, that table that's already available in BigQuery. And we're going to do a little bit of manipulation to some of the fields there before we join in the CDC health data, which is what's in pink there. So the blue and pink will eventually get merged into purple, which is table 6. Once that is created, table 6 will bring down a new pipe, which is the election data, and we'll do a little bit of manipulation to the election data before we merge tables 6 and 10 together to get election data together with health data together with some outcome data, which comes from the data source already on BigQuery. And then separately, we'll merge some track level data from the CDC with the track level data from MasterCard, aggregate that up to the county level. Tracks are at a finer granularity than county. And then we will finally merge tables 11 and 14 to bring all of the data together. So you've got outcome data, you've got the election data, you've got the health data, you've got the economic data, and it's all sitting in a single table
And two quick things, like this is, the proverbial 80% of, data science is the wrangling. This process takes a lot of time, right? So we're cutting through it today, but I would encourage you to go ahead and replicate this with those queries, with those data sets. And part of the reason that some of these queries do little things is because that pipeline is something that could break at any given piece. So just to pick one, we build a pivot table here and then we put percentages on it. That seems like a small step that you could put all in one, but in order to better be able to debug it, this step is very kind of, what's the right word? It's very precise. What's that? Decomposed, right?
Parts here.
That's number one. Then the second point is this county surge data. I think we have a link for it too. So later on, if this doesn't work for you and you want to investigate it, you can actually just jump into this table. Okay, and I think we're going to pick up there, Casey, is that right?
Yeah, we'll show you how to get to a link to hit here.
Okay, and so we're not going to actually run this, right?
No, you've already got all that run.
Yep.
Yeah, if you click down there, you go into your COVID data set, you've got all of those tables created. And if you wanted to go to the saved queries, you could just find this list of queries,
yep.
Q0 through Q4.
You can see it's built all those intermediate tables. And then the ultimate table here is the county surge table. So just replicating what Catherine was showing us, you can see its schema, you can see its details. We're now down, by the way, we're back to small data land, right? 600K. We all that pipeline really distilled down just to the essentials, what we needed. Number of rows, 3225. That is suspiciously close to the number of counties in the United States, because when you look at the data, which here is not sorted in any order by row, you'll see what we have. A FIPS code that was the key to joining all these things. That's the county itself, the name, the state that it's in, the cases that it had during the study period and the deaths, a measure of vaccination on the eve of the study period on that July 1st or June 1st date, and then the features, the predictor variables, if you will. Some outcome data mixed in here, but things like the proportion elderly over 60. A lot of things, again, normalized to rates, right, per 100K. So the mobility scores that are proxies for some of the things that you asked about earlier, workplace mobility, the county level measures of smoking prevalence, high blood pressure, obesity, the voting shares that we talked about. Again, not thinking those are literally causal, but that those may be proxies for some of the variables people asked about, such as local compliance with mandates or local mandates themselves. And then some of the economic data or things that are pseudo-economic in nature that might help identify disparities. So things like this inclusive growth score from MasterCard that uses business startups and economic data like that. Internet access scores, which just look at the first three rows. To think that that could differ by 30 points across counties, that's some of the heterogeneity we have at the county level. Spending per capita, a Gini coefficient, which measures kind of concentration. And then very importantly, health coverage insurance score, which again, 24 for this county, 76 for this county. When you look at things nationally or state level, you lose a lot of this, unfortunate differences we have and inequalities we have across this country. So just wanted to give you a flavor for those variables before we, I think, turn to modeling, Casey.
Yeah, so Eric, if you could go to the saved query.
Yeah, the which saved query? Sorry, up here. Yep, got it. It's in the view that I'm not the biggest fan of, so I couldn't find it. Project queries. So we talked about this earlier. When you're working as a team, you can just save these queries here. Which is it? COVID linear reg model. Right. Open that up in the query editor. Right. So rather than cutting those and pasting those queries in, which we did today for purposes of the workshop, you can just have your teammates have them here. So should I run all these? Well, no, they're already run. Why don't you go back to the slide deck and just show folks where they can get to all of those queries. So it's on slide 3. Sure. Right. So we've kind of done the actions. We've showed you how to build the pipeline. We've done some exploring and visualizing thanks to Catherine's great work. And now the model and explain piece. This is also another doc where those queries actually reside. Yeah. And so what you have here in this doc, you've got a number of queries that will run some linear regression models. And then you've got a bunch of queries at the end of this doc that will run an XG, a boosted trees model. Yeah.
So we're going to talk through the results of doing some modeling work here next.
Yep.
And I'd like to copy and paste these queries into a separate editor window. You can kick off the modeling work in BigQuery. And so this is one of the big selling points of BigQuery. It isn't just that it's a SQL environment where you can, wrangle data and do all this joining and aggregation work, but it's also an environment where you can run machine learning models. And it's all through SQL-like syntax. Folks at Google have written SQL-like versions that kick off these machine learning algorithms.
Yep.
So it hides a lot of the work you'd normally do in Python. Much of that is underneath the hood here. It makes it simpler for somebody who's not a data scientist, somebody who's more of a analytics professional to access the power of machine learning.
That's exactly right. I just wanted to emphasize that the XGBoost is a very advanced, machine learning method that at least used to win Kaggle competitions. It's great. It used to be very complex to implement, but as you can see here, this thing, well, which one should I pick, Casey? Where does it actually run it? Maybe a little bit up here.
Right there.
Yeah. This is a bit complicated, a little, right? But this is literally living in your SQL query. And a lot of this, in many ways, a lot of these settings are boilerplate. So in the same production flow, in the same environment, you can unlock the power of deep learning. And as we'll see, the explainability of those models as well. So
let's go over to the BigQuery editor window. We can look at those queries there.
Yep.
Okay, so we're going to take on a few of these queries, and we'll leave you to review the rest of them after the session. So let's just take the first one. The first one is going to create a unique identifier for each of the rows. And this is going to be key for setting up a randomized training and testing split of your data so that we can train our model on a portion of the data, 80% of the data, and have a 20% holdout, and we can test how well we do in predicting the counties we did not train our model on 20% holdout. Mm-hmm. So we create a unique identifier that's using this farm fingerprint function that's a part of GCP, which is great. That will create this unique identifier that we can then split on to create our training and testing sets.
Great. And then in the second query, we use exactly that to go into train test, which some of you may be familiar with, and if others aren't, this is the way we assess the fit of our model. We don't look at how well it fits our data itself. We hold out some of the data and we score ourselves on how well it predicts on the data that it didn't know about. So that's basically what we're doing here for folks who may not be familiar with that paradigm.
So we've got a case statement here that is going to create our 4 data frames, or 4 data sets, if you will. Data sets not in the sense of BigQuery data sets, in the sense of data science. Scroll up to that training test.
So where's that, Casey? Here, the lines 25 to 29.
Yep. So what we're doing is we're looking at that unique ID. We're modding it by 10, and we're finding all the ones that are 0 to 7. Those go into our training set. So we're labeling those as training in the field called data frame. Anything that's an 8 or a 9 goes into testing. And when there's no sufficient VAX data, we're throwing that into a separate data set or data frame called insufficient VAX data. And then there's going to be some counties that don't satisfy conditions that you're seeing in the first 2 when statements, where we don't have any deaths reported, or the population is too small in the county. We're going to call those prediction only, and we will not train our model on those types of counties. Counties that aren't reporting death rates or are just simply very small, largely rural counties.
Yeah, which does introduce a deep issue there where, because they're small, they may be different. And so they're not generalizable. So it's a trade-off. We won't have them in, but by putting out these counties, we're losing very little of the human population and a bigger percentage of the counties. So it's just a trade-off you sort of have to make, right? They're so small that some of these counties, if they had 7,000 people and they had 1 death, their per 100,000 death rate would be enormous. And at some point, it becomes statistically invalid. So we lose a little bit of generalizability, but we're able to predict better for 99% of the country, population-wise.
Yeah, so let's go down to our first model, which is a linear regression.
Does this sit there?
Yeah, so this is a simple linear regression where our dependent variable here is log of deaths per 100,000. So we created a transformed variable up above with a case statement where we take deaths per 100,000, we logged it. So that's our dependent variable. In BigQuery ML, that is the input label column. That's the dependent variable. You need to tell it that. And then in the select statement, you just go ahead and grab all the covariates. Let's just skip down to the multivariate linear regression.
Yeah, sure. Will. One comment as I scroll down is the first thing we wanted to do is just test a univariate theory that vaccination can predict deaths, which is, of course, part of the popular theory that you saw at the beginning of the class. But we're not just going to do univariate models. We're going to do many more predictors. Yeah. So is that a good one, Casey?
Yeah, this is a good one. So this is a linear regression model, and we can just go ahead and let's just talk through it first. So we're going to take everything in our table and treat them as covariates here in this multivariate linear regression. Again, trying to predict log of deaths, and we just need to exclude a few things that are not relevant to building out the model. Why don't we go ahead and look at just the weights so that we can get a sense that this model actually ran and gives us some kind of sensible.
Do I look at the output here? Is that what you're asking?
Just run lines 131.
Oh, okay, great. So this has already been run. So it'll have the stuff it needs upstream. So we'll run it here, and it's going to give you a sense of the weights. You know, if you're used to interpreting regression results. Let's see if I can get these all on the same screen. Casey, is that?
Yeah. So you have weights here, you have standard errors, you have p-values, the stuff you'd normally see in Python or in R if you ran a multivariate regression model.
And you can see initially vaccination showing up as a statistically significant predictor variable, as with blood pressure and a few others.
Yeah, great. So then let's get to the explainability stuff.
Okay.
So we scroll down. We evaluate these models out of sample. There's a couple scoring rules we use.
You want global explainability?
Yeah, let's get to the global explainability.
Yeah, and can you maybe just say a word like, I'll try to set it up like, interpretation of these models is critically important. There are cases where you care about prediction. You know, you're winning a Kaggle competition or something, you're a Wall Street wizard. There are many times, and public health is one of them, where you want to understand the drivers and the causal mechanisms so you can potentially intervene. So it's not enough to just fit these AI models, especially the XGBoost. We want to have a way to understand what the model's doing. You want to look inside the black box.
Yeah, so we're going to get this global explainability report, and this is a feature attribution, like a feature importance plot. And what we're seeing is blood pressure and health insurance coverage score and Republican percentage vote. This is an election vote from the 2020 election. These are the top three variables in terms of global feature attribution. So maybe some suggestions here in terms of what are the leading indicators of a summer surge and maybe the next surge is to track these variables at a county level.
And some of these are directly health related, right? Where you could imagine them being part of the etiology of disease. Others, like the third one, the voting thing, is probably not, right? So from a public health point of view, you'd want to say like, okay, it has predictive value, but I know it must be a marker for something else. Maybe it's a marker for local policies, for local mask wearing, for distancing. Somebody had the question earlier. That's a clue that you probably need to go and look for that data or try to collect it, because we know that what people voted on November 3rd isn't the actual causal driver, but it is associated. So there's actually a mixture of things here. Vaccination, for instance, fourth, we think is a direct protective agent. So I just want to point that out, as some of this is like causal results. Some of this is like where to dig deeper. What's next, Casey?
So these attribution scores for global explanations of your model. This is across all the counties. What are the most important features?
On average.
On average. And what they're averaging here is the absolute value of the Shapley values that are coming from the local explainability report. So we're going to go through the local explainability report, and then we're going to wrap up this session.
Yep. And just to note, Casey, we're at about 3 minutes. And
telling us we've got 4 minutes.
Yep, under 4. So should I go to the local explainability?
Yep, we're just going to run the next report, which is to do the explainability, and we're going to do this for the counties in Florida.
Yep. As it's pulling up, just to emphasize, we know kind of on average what are predictors. Now you're saying, what was it in Dixie County that was the driver of their rate? And you get it from this really advanced methodology that can look inside the black box of these models. So Casey?
Yeah, and if you'd like to learn more about all of this, there's a nice white paper that Google puts out called Explainable AI. And you can read more about the Shapley values, but that's what we're seeing here in the column called Top Feature Attributions dot Attributions. That first County, Dixie County health insurance coverage score is the top attribute for that county, and it has a Shapley value of 0.4914. Blood pressure is second. And if we scroll down through this list, we can see that sometimes the top
Glades, which for folks who may not be from Florida, Glades is out in the Everglades, and it is a very, very poor county in Florida. And what do you see? Number one, an economic factor, or something very similar to economic factor, which is basically access to healthcare, which is a proxy, well, direct and a proxy for other things, probably both.
Yeah. So you keep scrolling down through here, and I think you find some even more surprising top factors bubble up for a few of these counties.
That they just happen to have a value that was out of line with the country average, or
So if you were trying to design some health policy, just looking at this model and what explains going on, what explains contributors to.
Casey, let me briefly interject. Sarasota County, I grew up, great county, Siesta Key. It's a wealthy area, and so for that county, you see health insurance coverage scores are very low. It also has an elderly population, even for Florida. So what do you see? A lot of things that come with age, like high blood pressure. Okay, so
the negative score, right? Big negative score coming in second.
With the vaccination.
So designing health policy may require digging deeper than just looking at global explainability. Like, what are the most important features sort of across all of the counties, but looking into the individual counties and saying, what are the key features of each of the counties?
We can go beyond prediction. We can go beyond global prediction, and we can go in and say, okay, targeted intervention. And this is exactly goes back to where we started, right? What did Zients want to know? They wanted to know how to surge, and they wanted to be able to allocate resources and really target those resources. We're under 30 seconds. So I actually think since the AV tech has to get on to the next thing, we have to just say a quick goodbye. But thank you, first of all. Thank you. Hey. We loved it. You can contact us with more. As you can see, there's a lot to peel back here. So please be in touch, and thank you for your participation. Casey, any last word?
No, thank you.
Thank you all.
Awesome. Thank you all very much.